Did you go for cheese? All right. Good afternoon, and thank you so much for your patience. I know we started a few minutes late, but we did encounter this time some technical and streaming issues. So good afternoon and welcome to the House Health and Government Operations Committee. I'm Jocelyn Pena-Melnick, Chair of the Health and Government Operations Committee, and I'm joined by my fabulous Vice Chair, Delegate Bonnie Collison, to my left, and to my right, I'm joined by Counsel, Ms. Lindsay Road, who's amazing in guiding us with these bills that we are going to be discussing in the briefing today. This briefing is being streamed on the Maryland General Assembly YouTube channel. Before this briefing, all members will email a copy of each presentation. If you do not have these documents, please let the committee staff know, and we'll send you a copy. I'd like to thank Andrea for sending us the emails and all the paperwork that we need. And for the committee, please adhere to our usual committee rules of one question and one answer from the panel. And you guys have been doing great with the question. I've been getting a lot of positive, wonderful feedback about the quality of the questions. And I'm very proud, like a proud mama. And please keep your questions brief. Please keep in mind this briefing is scheduled to conclude, hopefully before 2:30 or by 2:30. Today, the House Health and Government Operations Committee will hear a presentation on a fiscal briefing in the Maryland Department of Health budget overview for the Department of Legislative Services. So I know we have the Department of Legislative Services here. So Mr. Romans, please begin your presentation. And again, thank you for being patient while we fix the technical difficulties.
Thank you. I think we're going to share this on the screen, maybe not. Yeah, there we go. All right, so we have a very long fiscal briefing document. I'm going to give you the highlights, the kind of the quick look part of it, and if you have time, happy to answer any questions.
Thank you.
So starting on that first page, the state budget for fiscal 25 is proposed by the governor. It's about $63 billion. It decreases by about $1.1 billion from last year. The major reason for the decrease is the decrease in state general funds. There's less general funds available than last year. We had built up a very large surplus last session that the General Assembly allocated for a lot of one-time expenses. For example, there was more than $1 billion of general fund pay-go, so using cash for capital projects last year that goes away. In addition, last session, the General Assembly allocated $900 million of the surplus to the Blueprint Fund to help fund future K-12 costs, and $100 million to the Transportation Trust Fund to help improve its financial health. So all that goes away and it drives the budget down a little bit. In terms of the 25 budget, looking at the general fund, the governor has left a fund balance of $103 million in the general fund at the end of 25. He also has $2.3 billion in the rainy day fund. That's about 9.4% of general fund revenues. So a healthy balance is both in the general fund and the rainy day fund. I think I'll jump ahead to the next page. Next slide. Thank you. So one of the key elements of the governor's balancing plan is nearly $1 billion of actions that are contingent on legislation. So it'll be up to you all what to do with those items. And I've grouped them in the presentation document into different categories. The first being revenues. There's about 100 million, or more than 100 million of kind of new revenues, if you will. I'm not going to go through them all. I will hit maybe the most notable one is lottery agent commissions. So the state reimburses lottery agents for selling the lottery tickets and for cashing the tickets. Back in 2022, the General Assembly increased the reimbursement rate from 5.5% of the sales to 6% of the sales. The governor is taking it back to 5.5% and also reducing the commission for cashing winning tickets from 3% of the ticket's value to 2%. So obviously that'll affect a lot of businesses around the state. So there'll be some noise about that, I suspect. That's really the most interesting of the revenue provisions. On the transfers to the general fund, the governor is transferring almost $250 million from various accounts to the general fund. Most of it is coming from the state's dedicated purpose account, which is a savings account, if you will, where we put money that's going to be spent over a multi-year period on various initiatives. There's about $250 million in that dedicated purpose account for cybersecurity for state government. The governor is saying, let's transfer $150 million back to the general fund. We don't need that this year. still leaves about 100 million in the dedicated purpose account for that purpose. The other notable transfers, you see 40 million related to the unemployment insurance trust fund. This is the unemployment insurance trust fund for state employees. The state is self-insured for unemployment insurance for its employees. We've built up a very large surplus. Governor's proposing to take 40 million of it and put it in the general fund. There's also nearly 700 million in spending reductions proposed that are contingent on legislation. The biggest item and the bulk of the number is about 500 million from not putting money into the rainy day fund. By statute, we're supposed to take some of the surplus from fiscal 23, roll it into the rainy day fund. The governor's view is he's got 2.3 billion in the rainy day fund. We don't need to put 500 million more in. Policy-wise, there's two kind of notable reductions. They both relate to higher education. The first is the Selinger formula, which is the aid the state provides to private and independent colleges and universities. The governor is kind of proposing to cut it almost in half, cutting it by about $64 million. Right now, under current law, the formula is based on providing aid for every student at the private schools, both graduate students and undergraduate students. The governor's proposal is to only provide it for undergraduate students. So the vast majority of that cut, about roughly 55 million, would affect Johns Hopkins University, as they are the private school that has most of the graduate students among the private schools. The other notable policy kind of related cut relates to community colleges. Community colleges have grown at a rate of about 12% a year since 2020 in terms of their funding. And the governor is saying we need to rebase that, and he's cutting $22 million. And that's going to be both that and the Selinger formula change are permanent changes. So those are not just one time. He's proposing to make them permanent in the Budget Reconciliation and Financing Act. The last section there is actually new spending that is contingent on legislation. So these are kind of administration initiatives that they want legislation enacted to create the programs. The Enough Act, which the governor's talked about a fair amount, I believe, is in there with $15 million in the budget if you pass the bill. And then the Center for Firearm Violence Prevention and Intervention is another $10 million initiative. There's a variety of smaller items. I just would note for in terms of this committee's jurisdiction, the assisted outpatient treatment grants of $3 million is another piece of legislation that would increase spending if you pass the bill. So let's turn to the next slide. Thank you. All right, so this is maybe the most important graphic in the document. It looks at the structural budget outlook for fiscal 25, the upcoming year, through fiscal 29. Structural budget, it's a reminder, is ongoing revenues. Can they pay for your ongoing spending? You have a deficit if your ongoing spending is greater than your ongoing revenues. And for fiscal 25, the administration is estimating roughly a $500 million structural gap. They close that through one-time actions so that they can fund that level of spending. But by their own count, it grows to nearly $3.5 billion structural gap by fiscal 29. That gap is equivalent to 12% of general fund revenues in fiscal 29, which is a fairly staggering number. We haven't seen that sort of deficit since the Great Recession. And before that, it was early in the 2000s when we were coming out of a recession. We were rolling out a K through 12 education enhancement then too. And there was a tax cut being phased in at the time. So it's very unusual to see this, especially when there's not a recession. So that'll be a challenge over the next few years for the General Assembly and the governor to tackle. Turn to the next slide. So there's two graphics here that are looking at sort of how did the governor balance the budget. Back in December, Legislative Services was forecasting about $1 billion deficit for fiscal 25, and the governor balanced it. You can see the blue part of the pie, the majority of the actions are spending reductions. And then it's the revenues and the transfers I've talked about and leaving a little bit less in the rainy day fund that account for the governor's balancing plan. In terms of the spending reductions, the bottom part of the graphic tries to highlight where those were taken. The biggest dollar one is that there was a lot of planned spending of cash on capital projects this year. The governor is proposing to instead use general obligation bonds to fund all those capital projects. Saves $500 million in terms of the operating budget. The other thing I would highlight for this committee is that the governor saved versus our estimate about $233 million in the Medicaid program. It appears just by having more favorable estimates of the trends in that program. We are somewhat concerned about this because the governor assumes more enrollees in the program than we assume, but has lower costs. So our analysts will be investigating that further as the session goes on to see if we believe it's an adequate funding for the Medicaid program. The other thing I would note on that bottom chart is that there's a big upward number, about 400 million, which is sort of unexpected enhancements in the budget. And if we go to the next chart, thank you. Go ahead. Yeah. So it highlights the 400 million of enhancements. There's really two really large items that account for most of it. The first is the governor is using general funds to subsidize transportation, putting 150 million of general funds aside to fund WMATA costs that the state is on the hook for. WMATA has an operating deficit in part because they don't have federal stimulus money to spend any longer. And so all of the entities that support WMATA are being asked to contribute more. The state's share is about 150 million. The governor is saying that by using general funds to subsidize transportation, he was able to avoid many of the cuts that were announced back in December, including he was planning to cut local highway user revenues, go to all of the counties and to Baltimore City as well as municipalities. So he did avoid cuts like that. One of the other cuts was to close MVA offices on the weekends. They're not going to have to do that as a result of putting this money into transportation. But I would note this is a one-year solution. Next year, he proposes in the Budget Reconciliation Act cutting the local highway user. So it remains sort of a longer-term funding challenge in the transportation area, just like we have in the general fund. The other major sort of area of unexpected higher spending is for employee compensation. The governor had a more generous than expected compensation package for state employees. It includes a 3% cost of living adjustment for state employees, as well as employee increments for most state employees, which equate to about 2.5% on average in salary increases. And then for employees who have 4.5 years or more of time with the state, they get an extra employee increment. So some employees could be seeing as much as like an 8% or so increase as a result of this budget. All told, it's about 350 million of general funds to support all of those compensation increases. I would note the state still has 10% of its executive branch positions vacant. So part of the justification for this in the administration is that they're trying to make sure we can hire the staff that we need. I'm not going to go through all the other detail there, but you can see some of what other highlights are in terms of new spending. At the bottom of that page, we start some sort of other key facts about the budget. Education goes up, K through 12 education by about 450 million, 5%. Healthcare provider reimbursement rates are increasing 3% for developmentally disabled providers, behavioral health providers, and most of the Medicaid community-based service providers, as well as nursing homes. After me, you'll hear a much more in-depth presentation on health, so I won't go into much else on health at the moment. On the next page, maybe the biggest general fund investment the governor makes is 488 million in childcare subsidies. The state saw a dramatic jump in the number of children participating in our subsidized childcare program in fiscal 23, nearly 10,000 more children participating, going up from like 23,000 to 33,000 or so. And the budget for the current fiscal year didn't support that kind of as an ongoing cost. So the governor's adding more than 200 million to the current year's budget to make sure we can maintain the funding for those children, and then continues that additional funding in fiscal 25. So it's one of the bigger kind of policy decisions in the budget. Talked about the Transportation Trust Fund. I would just note, in addition to that 150 million for WMATA, the governor is providing about 187 million of general obligation bonds to subsidize costs that would otherwise fall on the Transportation Trust Fund, including 167 million for WMATA capital costs and 20 million for the Howard Street Tunnel project. One other notable item is the governor is taking strategic energy investment funds, which in statute are used for a variety of clean energy and other such purposes. And he's taking them and using them for the climate pollution reduction plan that he's proposed. So that's $90 million in fiscal 25. Last thing I'll mention on this page is on the capital budget. The General Assembly, through the Spending Affordability Committee, asked that the governor leave 200 million of general obligation bonds for the General Assembly to allocate as it wishes. The governor left 50 million, so that may limit what's available for bond bills and so forth. Going to the next page. The big picture summary here is we kind of highlighted for the fiscal committees what some of the major issues for them this session will be. I kind of have alluded to the big ones: the general fund health, longer term, transportation trust funds health, the Maryland Emergency Medical Systems Operation Fund, which is projected to run a structural deficit of its own of over 30 million a year in the out years. So there's a number of places where the commitments the state has made exceed the ongoing revenues, and some thought has to be given about priorities and how to fund them. And then I'm going to skip ahead a couple of slides. Keep going, one more slide. Thank you. This is the last chart I'm going to talk about in my presentation. It looks at the Blueprint Fund. So the Blueprint Fund is the fund that we're using to try to fund the Kerwin K-12 enhancements, if you will. And this shows you from fiscal 24 to 29, the projected expenditures. This is administration's projected expenditures. And then it breaks down how we're paying for it. So the blue bars show you the ongoing revenues in the Blueprint Fund. So those are most of our casino revenues and about 12% of the state sales taxes deposited into the Blueprint Fund. And that covers about $1.3 to $1.4 billion of costs each year. And you can see on the left-hand side, in fiscal 24 and 25, it actually funds most of the Blueprint implementation costs. The yellow bars show you the costs that are being covered with surplus that is in the Blueprint Fund. The state has put a lot of money into the Blueprint Fund in recent years to build it up so that there will be enough cash to help roll out the implementation. And that money supplements the ongoing revenues and gets us to fiscal 27. And that's when you start seeing the green bar up here, which is the Blueprint Fund is fully subscribed, and we need to use general funds to cover the rest of the Kerwin implementation costs. And so in fiscal 27, the estimate is about 400 million of general funds are needed. By fiscal 29, you can see it gets well over $2 billion. And the Kerwin implementation continues through 2034. So that green bar would grow if I showed you more years in each subsequent year. And this is really the major driver of that general fund stress I showed you earlier. It's that we have this significant growth in education costs that fall in the general fund in the out years. Madam Chair, that concludes my remarks. Happy to take questions at this time.
That was pretty good. I think even for anyone who does not have any ideas of what the budget does, you made it very, you focused on the right thing. So thank you. And thank you for all your efforts and for coming to us. I am going to start with questions now. I first see Delegate Hutchinson, followed by Delegate Hill, and then Delegate Woods. Two more here.
Thank you, Madam Chair. Thanks for coming again. I saw you earlier this morning at our caucus, and so it's nice to hear it again. I need a point of clarification that I've heard difference of opinion. So let's say a department has round numbers, 100 positions, but they realize they can't hire all 100. They make it through the year with 90. That leftover budgeted money, do they have the ability and the right to spend that in the department in other areas? Does they have to stay in just personnel, or does that go back to the general fund?
So, two-part answer to that. So first, the state budget assumes that every agency will not fill every position because there's always going to be, people coming and going. So in the state budget for this year, it funds about 92% of the positions are actually assumed to be filled. If an agency does not spend all the money on personnel because it can't fill positions, it can use the money for other operating activities in the agency, not just on personnel. They can move money around, pay for other things.
Thank you, Delegate Hill.
Thank you. And David, thank you for doing this every year and making things crystal. We've been projecting pre-COVID out year structural deficits. We then got one-time COVID money that for the most part, we tried to spend on one-time projects, right? So can you just give us a sense of whether the deficits we're looking at now are pretty on line with what we were predicting, say in 2018, 17 pre-COVID, 2019, or are we worse off are we doing worse or are we better?
Yeah, I think we're doing worse. I mean, in part because like some of those earlier deficits, there's been a lot of legislation, including the Kerwin Blueprint program that's passed that was funded for a few years, but it doesn't, we don't, as you saw, we don't quite have enough money to fund. So we were projecting structural deficits prior to the pandemic. So it's not a surprise that there are structural deficits, but the magnitude is greater and is quite significant.
I have Delegate Woods, followed by Delegate Kaiser, and then Delegate Taveras.
Part of my question. So the second part is just real simple. For the ongoing revenues, you said the casino revenues and what?
Some of the state sales tax revenues go into the Blueprint Fund. So about 12% of all the sales tax we collect.
Thank you. I have Delegate Kaiser.
Thank you, Madam Chair.
You're
Thank you, Mr. Romans. My question has to do with the dedicated purpose account that you mentioned for cybersecurity. What could the impact of that $150 million being moved away? Does that hurt our cybersecurity efforts?
So the state has been in the process over the last few years of doing assessments of the state agencies to see, how safe are we and what are the deficiencies. And they have not completed that process. So I think it's hard to answer your question because we don't have a number of, okay, they've identified this group of issues and here's what it's going to cost to resolve those. And here's the prioritization. Obviously, there's some that are probably greater risks than others. So we don't have enough information at this point, I would say, to really put a hard number on, well, how much do we really need to fix and remediate all of our problems?
Thank you. Delegate Taveras, followed by Delegate Lewis.
Thank you, Madam Chair.
You're welcome.
I would like to see if there's a way that we could probably do some time offline, but I'm highly concerned that there are no sustainable fixes. But what do you recommend that we do to create a long-term sustainability problem to close the $1.1 billion fiscal structure, that gap?
Well, I don't have to vote on these things, so I'm not going to give you a lot of specifics here. But I would say, I think it's sort of, the state first has to, I think, look at its priorities in terms of what's on the books and what spending we do, and see if there's spending that you don't think is, is higher priority, doesn't need to be done. And then if you can't resolve the problem by, prioritizing, then you have to start looking at revenue options to, make up the gap.
Delegate Lewis, followed by Rosenberg.
Thank you, Madam Chair. I have lots of questions, but I'll just pick one. We know that at the federal level, when it comes to tax collection, there have been challenges, which is one of the reasons why, if I'm not mistaken, one of President Biden's big signature bills included additional funds for IRS. It's more efficient auditing, more efficient tax collection, et cetera. At the state level, are we facing something similar?
The state has, I don't have a number, but the state certainly doesn't collect every dollar that it probably should be able to. I think the Comptroller's Office could probably provide an estimate of that. One of the things the Comptroller's Office and the state have been doing over multiple years is they're implementing a new IT system for tax collection and monitoring. I think they are hopeful that that will help them better identify, places where they should be doing more auditing and so forth. So I think the state, there's opportunities there. I don't know that it's the same level of opportunity as at the federal level.
I have Delegate Rosenberg, followed by Johnson.
Thank you, Madam Chair. By virtue of the constitutional amendment that we adopted, the voters then adopted, last year was the first year that we, as the legislature, could increase any specific appropriations while cutting commensurately somewhere else in the budget. To what extent, both number-wise and policy-wise, was that done last year? And is there any ballpark number out there yet that you can share with this committee regarding how much money could be available for that kind of switch in the current fiscal year?
I mean, last session, there was more than $1 billion of legislative ads. Now, last session, we were very successful in identifying some large errors that were made in the budget that created some opportunity for some easy reductions that were then used to make ads. We are very early in the budget analysis process at PLS, so I don't have a number yet as to what level of reduction or opportunity there will be, but there will certainly be some opportunity. I will say one of the things that's different from this last year to this year is there's a Budget Reconciliation Act, and as you saw, there's things on there that people may not want to do. And so unlike last year, the committees need, if they don't want to do some of the cuts the governor's proposed, they need to find alternatives as well as look for room for ads. There's a little bit more competition for any suggestions we have in terms of areas where there's some surplus in the budget.
Thank you for being patient as you address these questions. We have next Delegate Johnson, followed by Delegate Morgan.
Thank you, Madam Chair, and thank you for your
pleasure.
presentation today. My question is, were any of the recreational cannabis funds projected into any of these numbers anywhere?
There are, when the state is achieving revenues from recreational cannabis, and that is assumed in the state's revenue estimates, yes.
My pleasure. Delegate Morgan.
Thank you. Thank you, Madam Chair.
You're welcome.
Thank you for your presentation again. It was good to hear it second time around. And maybe I might have missed something. When you had the chart up there talking about the out years and the soaring deficits to years to come, what is the current state of revenues? Are they coming in on pace with expectations, or are they actually starting to falter a little less?
Yeah, I mean, the Board of Revenue Estimates reviews the estimates a couple of times a year in December, and then they'll again in March, they'll take another look. In December, they adjusted revenues down a little bit. The sales tax has been a little bit weaker than it had been and how it was being forecasted. We've also seen some weakness in our casinos. I mean, I think there's a question of whether with sports gaming and everything else, whether we're starting to cannibalize across the different betting opportunities. But we haven't had any, substantial reduction in revenues. What we're not doing is the revenues are not projected to grow particularly robustly in future years. We're talking, like 3% growth, which is fine, but it's not robust and it certainly doesn't keep pace with the spending.
Absolutely.
It's predicted at 3% growth. That's below the rate of inflation. Correct.
But it's below where we've been in terms of inflation. I think inflation is expected to moderate some in most of the national forecasts.
Point where it's, if let's say there's 3% growth and maybe there's 3%, 4% inflation, that's negative revenue.
Right, if we have inflation at 4% ongoing, yes.
My pleasure. We have Delegate Martinez.
Thank you, Madam Chair.
You're welcome.
And thank you for your presentation and answering all these questions so diligently. My question is pertaining to Kerwin in particular. I guess fully understanding the implications for our localities. I come from Prince George's, and a lot of the noise that we're hearing is can't afford it, it's too much, the payments. So could you explain how the localities' payments to Kerwin kind of help us balance our obligations to Kerwin and what that relationship is, just so I can better understand how it's reflected here in the presentation?
Yeah, so K through 12 education costs in Maryland are sort of a shared cost between the state government and local governments. And the Kerwin initiative, as you saw, has a big impact on the state budget in terms of increase in costs, but it also asks the locals to share in some of those costs. So I think almost every county in the state is seeing growth in their K through 12 spending to meet the Kerwin requirements. So I think it's not just Prince George's County, it's everywhere. And that was part of what was envisioned when Kerwin was passed. I think the question is, are local revenues growing at a fast enough pace that it doesn't become a huge stressor or not?
Absolutely. Go ahead.
I guess getting to the question, you say it's a shared responsibility, but the way it's described oftentimes from council members or even the county exec's office is around, we're making these payments to the state that then I guess are dispersed later on at a later date. Could you explain that relationship? Like paying into Kerwin is like a phrasing that they continue to use. And I wasn't here when it was passed. So just understanding that
No,
relationship.
the local budgets go to support the local school system. So they're not paying, the money isn't going from, I'll just use Prince George's, from Prince George's to the state to then be allocated out. It goes from Prince George's to the local school board. But it's a requirement. I mean, the state is putting these requirements. You have to put at least this much into K through 12 education this year. So it's a state requirement, but the money stays in the locality.
Thank you. Any other questions? Seeing none, I want to thank you on behalf of the committee for coming and for being so patient as you address the questions, okay? I hope you have a blessed afternoon.
Thank you.
Thank you. Next, we have the Maryland Department of Health budget overview. And will you be so kind and come up, please? We have Naomi Kamuro, Policy Analyst. We have Ann Braun, Senior Policy Analyst, and Victoria Martinez, Policy Analyst. I want to welcome you to the Health and Government Operations Committee. And I
Thank
love
you.
this, an all-women's team. Okay, no offense to the men here. Okay,
Thank you, Madam Chair. Good
you're
afternoon.
welcome.
My name's Naomi Camuro. I'm a policy analyst with the Department of Legislative Services. I'll let Ann and Victoria introduce themselves and then we'll begin our presentation.
Hi, my name's Ann Braun, also a budget analyst with the Department of Legislative Services.
Hi, my name is Victoria Martinez, also a policy analyst at the Department of Legislative Services.
Okay, so we'll start on page 2, which is projected on the screen. This chart shows the budget changes for the last 3 years for the entire Department of Health. The fiscal 25 allowance includes $19.6 billion for the department, which is a reduction of $261 million from the current working appropriation. In just a couple of minutes, we'll get into the more detailed changes driving that decrease. Moving ahead to page 4, we've outlined the proposed deficiencies for fiscal 24 that are included in the fiscal 25 allowance. Those total $635.3 million, and I'll just highlight a few of them on this page. Most of that is driven by Medicaid shortfalls related to Medicaid services. So there's $420.6 million in deficits related to Medicaid services in fiscal 24 and a $204.3 million deficit related to Medicaid services in fiscal 23. There's also a deficit of $100.5 million to support the Healthy Babies Initiative in fiscal 24. On the next page, Victoria will lead us through a discussion of COVID funding in the budget.
I'll be talking about the COVID-19 federal stimulus funds. Between fiscal 2021 and 2024, MDH received COVID-19 related federal funding due to the public health emergency through different stimulus bills. The largest increase in federal funding was a 6.2% enhanced federal match on qualifying Medicaid expenses through the Families First Coronavirus Act of 2020. The additional federal fund matching reduced the need for general funds in those years, and this federal support was phased out and fully expired on December 31st, 2023. Similarly, the American Rescue Plan Act included a 10% enhanced federal match on qualifying home and community-based services spending. General fund savings from the enhanced match had to be fully reinvested in home and community-based services by March 31st, 2024. In fiscal 2025, MDH is still spending $48 million in remaining federal funds from other stimulus bills and sources like CDC grants that are shown in Exhibit 1, but at a decreased amount compared to the $138 million budgeted in fiscal 2024. As shown in this exhibit, the fiscal 2025 allowance still includes additional federal funding from the ARPA, CARES, and Coronavirus Response and Relief Supplemental Appropriations Act stimulus bills. These federal funds support public health activities such as COVID data reporting, vaccine outreach efforts, and public health workforce support. So this decrease in federal funding contributes to the overall reduced MDH spending in fiscal 2025.
On the next page, we've broken out the fiscal 25 allowance by purpose. So a majority of the funding, 88% of the budget, is allocated to provider reimbursements for medical services under Medicaid, behavioral health, and the Developmental Disabilities Administration. The remaining 12% of the budget is allocated mostly to personnel and operational costs. On the next page, is where we've outlined the major changes in the budget. So as I said earlier, the entire budget is decreasing in the fiscal 25 allowance by $261 million. And that change is driven mainly by lower estimates for Medicaid enrollment. So Medicaid costs are decreasing by $552 million. The decrease is partially offset by an increase in personnel costs because the Department of Health is adding hundreds of new positions in fiscal 25. I'll skip ahead to page 10 and just highlight, like Dave Roman said, there's several contingent reductions included in the budget. In the Department of Health, the biggest one is $12.4 million included in the fiscal 25 allowance, which would be reduced contingent on legislation that would delay the implementation of the Family Act. And then there's a couple others noted on this page here. I'll turn it to Anne for our Medicaid discussion.
Great. So this next section provides a brief overview of Medicaid enrollment. So Exhibit 2 on the next page. This shows monthly Medicaid enrollment starting in January of 2020. So during the COVID-19 public health emergency, Maryland was required to freeze Medicaid disenrollments as a condition of receiving that 6.2% enhanced match that Victoria mentioned earlier. So as a result of that, enrollment grew by 29% from just under 1.4 million Medicaid participants in January 2020 to about 1.8 million in May of 2023. Starting on April 1st of 2023, the department initiated a 12-month unwinding process to redetermine all Medicaid participants' eligibility. And so under that schedule, the first disenrollments took effect at the end of May. And so that's why you're seeing June of 2023 show the first decrease in enrollment. I'll also note here that enrollment starting in July of 2023 reflects participants served under the Healthy Babies Initiative. And most recently, that was 6,710 enrollees in the program as of December of 2023. So then turning to Exhibit 3 on the next page, this shows average monthly Medicaid enrollment in each fiscal year. For fiscal 24 year to date, there is a slight decrease already, and that's from the impact of the first half or first 6 months of the unwinding process. And then turning to the budgeted enrollment, compared to the prior year, fiscal 24 budgeted enrollment decreases by about 5.3% to 1.66 million Medicaid participants projected. And then in fiscal 25, the allowance projects or budgets that due to the continued unwinding process and favorable economic trends, Medicaid enrollment caseloads are expected to further decrease to 1.59 million. And so as Naomi said earlier, this reduction in budgeted Medicaid enrollment is the largest driver of the overall decrease in the Department of Health's budget.
So the next page begins our discussion of personnel in the Department of Health. I'll point out first that the department is experiencing carrying a much lower vacancy rate than it has in recent years. So Exhibit 4 on this page shows the number of vacant and the number of filled positions, as well as the percentage of positions that are filled in December of each of the last 5 fiscal years. And so between December 2022 and December 2023, the vacancy rate decreased by about 3%. And most recently, as of January 1st of this year, the vacancy rate has decreased even more to 10.7%. I'm going to skip ahead to page 15 and talk about some contractual conversions that were authorized by the Board of Public Works in fiscal 24. This chart shows in which offices those positions sit. So a majority of them are folks that work at the 11 state inpatient hospitals. MDH converted positions that then total 279 merit positions. So most of these positions are already filled in fiscal 24, but converting from contractual FTEs to merit positions. And this is on top of the hundreds of positions that are being added in the fiscal 25 budget. I'm going to turn it back to Anne to talk about the next 2 issues.
So as part of these overview analyses, we try to highlight a couple policy or fiscal issues that tend to affect multiple programs within the Department of Health's budget. And so first, I'll discuss this first issue that has to do with home and community-based services waiver programs under Medicaid. So page 16 lists the Medicaid waiver programs, and these provide services like case management, personal care, and nursing to help waiver participants live at home or in a community setting instead of a nursing facility or a state health facility. So the Office of Long-Term Services and Supports under Medicaid manages 3 waivers, and I'll highlight the community options waiver under that list. DDA manages 3 waivers, and then the Maryland State Department of Education administers the autism waiver. So then moving on to Exhibit 7, this shows the number of individuals on registries for the community options, autism, and DDA waivers. So under the community options waiver, there has been a significant increase of about 41% in the registry from fiscal 21 to 23, when there was over 25,000 individuals on the registry for that program. Despite having this growing registry in the community options waiver program, MDH has not filled the authorized 6,350 slots each year under that program. The most slots MDH has been able to fill is just under 4,700 slots in fiscal 22. And so on page 18, there is a list that shows the reasons the department has given in the past for not using all of its authorized waiver slots. So just to highlight a few of these, the provider network has limited capacity to be able to serve waiver participants. And then the second reason given was that the community options waiver has a complex eligibility screening process. And so in combination with high vacancies in the department, specifically among eligibility determination staff, that has caused some administrative delays. And so then turning to Exhibit 8, this chart shows that MDH has performed outreach to the registry by sending out 300 applications per month. Recently, Chapter 738 of 2022 required MDH to increase this outreach to 600 applications each month. And so MDH started doing that in November and has plans to increase the outreach further to start sending out 700 applications per month once staffing improves. The exhibit also shows with the diamond and the triangle markers that less than 40% of applications have been returned in both of the years shown. And then the 3 sets of bars on the right, that shows the outcomes on average for each month of those returned applications. And so I'll just highlight that in calendar 22, even with only a little over a third of applications being returned, at the end of each month, MDH would still have about 39% of those applications pending without an eligibility determination. The department attributed these processing delays to high vacancies among the staff that support this waiver program. And in September 2023, MDH had reported 30 total vacancies, including regular and contractual personnel for those positions. So then turning to the next page, the discussion kind of shifts a little to another 2022 bill, the End the Wait Act. This bill required MDH to develop plans to reduce wait lists for HCBS waiver programs by 50%, with the plans beginning in fiscal 24. Let's see. So these reports were submitted in February 2023, and Exhibit 9 on the next page. This outlines the proposed plans for each waiver in terms of how many individuals would be enrolled each year and what the cumulative cost to the state would be through fiscal 28 to serve those additional enrollees. I will highlight for programs like Community Options Waiver, the number of enrollees added per year does take into account that lower uptake. So this, even though the registry reflects a higher number, it still reflects the estimate for how many people would actually enroll and would be deemed eligible in each year. And I'll note here that the costs listed also include increased staffing needs that the department has said it needs under each waiver. The reduction plans did mention the need to support HCBS providers to increase capacity, but this chart of the state cost didn't include a specific cost for that component, and the plans also didn't specify specific activities that would support that particular effort. So most recently in fiscal 24, there was $6 million budgeted in the dedicated purpose account for end the wait activities. And the fiscal 25 allowance also includes another $10 million for provider recruitment strategies and capacity building. The department did not yet have a plan for how it would spend that $10 million for provider capacity, but the department did offer to send details to the General Assembly once that spending plan is determined. And so next I will move on to the second issue that we've highlighted in this analysis, and that has to do with provider rates and rate setting studies. The fiscal 24 budget included language restricting funds until the department submitted a report on current rates and rate setting studies. And so Exhibit 10 on the next page. This was information that came from that report from the department, and it shows rate increases specifically for providers that have received mandated provider rate increases over the past few years through legislation, typically tied to the minimum wage. So this includes long-term services and supports providers under Medicaid. It includes DDA providers and most behavioral health providers. The rate increases in italics on this chart show which ones were mandated. I also wanted to highlight that some of the home and community-based service providers in particular received additional rate increases that were completely funded with federal funds through the American Rescue Plan Act enhanced match that Victoria mentioned earlier. And so those rate increases supported with the American Rescue Plan are starred in that chart. Most recently, the providers received an 8% rate increase on January 1st of 2024, and that reflects the accelerated rate increases that were scheduled to take effect in fiscal 25 and 26. Those were moved up in last year's budget in line with the accelerated increase in the minimum wage. And so because of that change, there was no mandate for provider rate increases in fiscal 25, but the budget does include a 3% rate increase for those providers. The rest of this issue discusses current rate structures and ways that rates were set across the different administrations. So I'll just really briefly touch on a few things I'll highlight. So under Medicaid, rates, particularly for physician evaluation and management services, are often compared to Medicare rates. And in the fiscal 25 allowance, those rates continue to be funded at 100% of the Medicare rates. Under DDA, I'll just highlight that that system is still transitioning from a prospective payment system to a fee-for-service reimbursement system for its rates. And then under the Behavioral Health Administration, there was 2017 legislation that required the department to conduct an independent rate-setting study for community-based behavioral health services. Under this, MDH described a two-phase process for the study, with the first step being designing a cost report template for providers to fill out. And most recently, MDH provided an update that it expects to bring a contract for that cost report template design services to the Board of Public Works in spring of 2024. So with that, I'll pass back to Naomi.
This is the last issue that we'll present, and it's related to the recent audit by the Office of Legislative Audits of the Department of Health, looking at their federal fund accounting procedures. So in January of 2023, in their budget closeout report for fiscal 22, OLA identified $3.5 billion in federal funding that lacked proper documentation. After being alerted of this, MDH started work to verify the various payments and accounts. And as of November 2023, had verified 2.1 billion. They're still working to review accounts to verify the remaining $1.4 billion. And since then, OLA also released an audit report in October of 2023, looking more in depth at MDH's federal fund accounting procedures and processes, and identified many different deficiencies. So that report included 17 different findings related to MDH's process, and issued 28 recommendations. Also, as of November 2023, MDH had implemented 13 of those recommendations, and they're continuing to work with an external accounting firm to review any accounts that were not reviewed by OLA, and ensure that they can recover as many of the funds as possible. I will stop there, but just note that in this report, there's also an update on the Cigarette Restitution Fund, which is something we include in this analysis every year, as well as appendices with other detail on personnel, budget, and caseload data. And we'd be happy to take any questions that you have.
Thank you for your presentation today. It was very clear and very thorough. We appreciate it. So I'm going to open it up for questions now. Are there any questions regarding the budget on health? Delegate Taveras. followed by Delegate Hutchinson. And Delegate Bagnell.
Thank you, Madam Chair. I have two quick questions, if you may allow. I know I'm only allowed to ask one.
If you just go ahead and ask them, go ahead.
Okay. The first one is with regards to the opioid restitution fund. This is the Purdue Pharma funds. We're talking, is this 15,809,000? What exactly is the change that's occurring there? And where is that money going to be spent? And then the other question is.
Let them answer the first.
Okay.
Thank you.
Yeah, sure. So the fiscal 25 allowance is showing about a $15 million increase due to the latest payment from the Purdue Pharma settlement. So that's deposited into the opioid restitution fund. The money that's deposited into the opioid restitution fund is then distributed out in several different ways to local jurisdictions. So a lot of that money is going to the local health departments, but some of it is also being issued through competitive grants. So the opioid restitution fund is discussed in more detail in a different analysis. So I can't provide a ton more detail beyond that until that's finished in the next week or so. But there is an increase from the current appropriation.
The second question.
Yes, I'd like to see that report. And with regards to the lack of oversight and ineffectual procedures regarding the unrecovered federal funds, is it that 3.5 billion in federal fund revenues were already spent and we don't have the justification, or is that money still there?
So the $3.5 billion are items in revenue accounts that didn't have the appropriate backup documentation to then process the reimbursements for eligible spending. And so the danger with this, the risk with this would be that there would be unrecovered dollars that the state could have recovered through federal funding because they were spent on expenses that were qualified to be paid for through federal dollars. Does that answer your question? Okay.
Thank you. Delegate Hutchinson, followed by Bagnell.
Madam Chair,
My pleasure.
thanks for being here. I look forward to reading it all through it, but you went through that very nicely. Back in December, we came here for a briefing that the department put on in terms of the overall cost implications if we were to move forward with providing healthcare to undocumented immigrants. And there were different cohorts of what we would do, but I remember the most extreme was about $1 billion over the next 5 years. And I remember the gentleman's response back was, yeah, but that's only $200 to $250 million a year. But if we were to move forward with that, none of that is in here. There's nothing baked into this in terms of that potential legislation. Is that correct?
I don't believe so, but I'm happy to follow up and confirm for you, but no, I don't believe so.
And I can answer that question for you. It is not in there, and there's no bill at all this session to provide that care. That was just a study that was done to see what it will cost. What is being introduced this session, just for clarity, it's a bill. Presently, the federal government does not allow undocumented individuals to purchase insurance on the Maryland Health Benefit Exchange, on any federal exchanges. They don't allow it, even if you have the money. So basically, they have granted permission, which is called a 1332 waiver, to California, to Washington State, to Oregon, and other states that have followed, allowing undocumented individuals to buy insurance. And the bill that will be introduced, that was introduced by Vice Chair Collison, is a bill that would allow Maryland to seek a waiver like those other states. And the waiver, the bill has 0 fiscal analysts because they can do it. The Maryland Health Benefit Exchange can implement it with existing resources. It has 0 subsidies, and there's actually language that says no subsidies allowed unless you come back to the General Assembly. And it's basically allowing people to buy with their hard-earned money. That's it. But great question. Thank you. Next I have Delegate Bagnell, followed by Johnson.
Thank you, Madam Chair, and thank you for your presentation. Turning back to the home and community-based services waivers, my understanding is there is a 50% federal match. So do we have an analysis of how much federal grant money we have not been able to access because of our challenges with going through the wait list? And do we and is there any penalty for not meeting capacity?
So you're right that it is a 50% federal reimbursement for these services because it's under the Medicaid program. So as a waiver program, it helps people who wouldn't ordinarily qualify for Medicaid, but they can receive those Medicaid covered services through these programs. Because it's based on reimbursement, so any dollar that the state spends, it does get that reimbursement. It's not like there's an exact figure in terms of as if it was a block grant or some other kind of grant with a specific number. But as we noted, the MDH is able to fill up to over 6,000 slots in community options as an example, but has only been filling up to 4,700. And so that's an example where there would be more federal reimbursement if it was filling all those slots, but it's just based on however many dollars the state spends. It's a matching rate.
My pleasure. Delegate Johnson.
Thank you, Madam Chair, and thank you for the presentation. My question kind of piggybacks on Delegate Bagnell's question. We looked at this a few years ago, and the cost of the care in the home was way cheaper than the cost of care in a nursing home. So with the federal match and the cheaper cost, was that calculated in on when you came up with the state cost, or would we actually end up with the state savings?
So I think the state costs that are listed in the reduction plan, so that would be the cost of serving more people off the waivers. I don't believe it was a cost benefit analysis, so it wouldn't tell you how much possible savings there were. I believe a couple of years back, there was a report from the Hilltop Institute that did find some additional cost to the state for each waiver slot that you fill. So it does cost the state more, but it acknowledged that there's other non-quantifiable costs non-quantifiable benefits to serving people in home and community-based services. So even though they did find that it does cost the state more to serve people through those waiver slots, they did acknowledge that there were other benefits. But yeah, in terms of the state plan, that's the cost of the reduction plan. So taking people off those registries and wait lists and getting them into the services, that exhibit shows the Department of Health's projection for what it would cost to serve those individuals. So yeah, so the possible savings or other benefits aren't incorporated in that.
You're welcome. Delegate Vice Chair Collison.
Thank you, Madam Chair. Just to follow up, when they did the analysis, when Hilltop did the analysis, they did speak to the amount of money the state could save if folks were served in their homes versus being put into nursing homes. So it's not, you haven't included a cost analysis benefit, but there was one in Hilltop that was fairly significant. So for each, if I'm recalling correctly, for each person who is not put in not putting in a nursing home, but given care at home, saved about $20,000. So you multiply that by the number of people we're serving in the slots, and it was pretty significant. I think the answer is
isn't that so? This is a funny committee, just kidding. Any other questions? Seeing none, I just want to thank you on behalf of our entire committee for your patience in addressing the questions and for the information and the efforts that you put into coming here today. We really appreciate you, okay?
Thank you.
And our doors are open anytime you want to come back. To the committee members, I want to say thank you for each and every one of you for your thoughtful questions. They're all important. Thank you so much. And this actually concludes the briefing, and we're now going to go into bill hearings. So I have to adjourn and then come back, or yes? All right.